Welcome back. High blood pressure is often called the silent killer, and of course for good reason. It affects more than 1 billion people worldwide. In 2022, it was listed as a death contributor in 685,875 deaths. And this condition also tends to impact underserved communities more. With World Hypertension Day coming this Saturday, we're joined by Dr. Phillip Levy from the Wayne State University to talk about why blood pressure is the awareness of it is more critical than ever. Dr. Levy, good to see you this morning. Why is hypertension considered to be such a major global health issue?
Well, good morning, and thanks for having me on to talk about this topic. As you mentioned, it affects almost 1 billion people worldwide. It's the single most important risk factor for cardiovascular disease, which is heart disease and stroke. And those are the leading killers of people in the world. And so
Recording in progress.
that can be entirely prevented by better management of high blood pressure. So if you get your numbers checked, you go to your doctor and get your blood pressure, awareness up, you can do something about this. And that's why it's so critical.
So I think I'm going to answer my own question when I ask this. We know that high blood pressure often doesn't have any symptoms. Is that exactly why it makes it so dangerous?
Yeah, and I think people become a little desensitized to the numbers, right? Sometimes we don't think they're accurately measured. Even when you go to your doctor's office, the blood pressure may be a little bit high. Doctor may say, hey, it's a little bit of stress. Maybe you were, on the run this morning and didn't get time to relax before you had your blood pressure measured. And so we tend to minimize it a little bit, and when we should be doing just the opposite. When the blood pressure is even a little bit elevated, that's the time to start to change your diet, change your lifestyle, do other things to bring it back down.
Yeah, so you mentioned measuring accurately and making sure that that's a big part of measuring blood pressure in the first place. Now, this year's theme is measure your blood pressure accurately, control it, live longer. So can you speak to why accuracy is so important when it comes to monitoring blood pressure?
Yeah, you don't want to think your blood pressure is normal when it's abnormal. You also don't want to think your blood pressure is abnormal when it's normal. And so when you go to the doctor's office, you go anywhere and get your blood pressure checked, it's really important that you wait 5 minutes, sit down, relax. Both feet should be on the floor. If you have to go to the bathroom, do that ahead of time because the tension in your bladder could potentially make your blood pressure go a little bit higher. Don't drink coffee before you go in. If you smoke cigarettes, which you should think about stopping doing, don't smoke for a little bit before you go in there. We want to do everything we can to make sure the numbers that are measured are most accurate. And the way to measure blood pressure, it's more accurate when it's not done manually. Meaning, if you go to the doctor's office and they're putting a stethoscope on and measuring with the pump, that's not as accurate as the automated measurements. And the measurements that are done 3 times in a row, what's called triplicate blood pressure measurement, is the most accurate because it smooths out some of the sort of aberrant numbers that may arise just for whatever reason.
Yeah. So you talked about a lot of factors there, and I know that there are a lot of factors that impact blood pressure. Can you kind of speak to that? Like, why do we see so many factors affect our blood pressure, and why is that even more so of a concern when we're talking about getting it checked?
Yeah. So things like stress are very important factors that affect blood pressure. But as are things like high sodium intake, salt load is a very important thing, lack of exercise, poor diet in general. And as I said, smoking cigarettes, very, very important factors that go into it. We like to talk a lot about genetics as well. And there is a predisposition in certain populations to have higher blood pressures, but sometimes that genetic predisposition won't get activated unless you're doing the things that I mentioned. So if you have a predisposition to be hypersensitive to salt, you can avoid that by not taking in salt. So, a lot of people want to say genetics is really important, and it is, but it's not the most important thing. There's a lot of other things that we can do ourselves to help control blood pressure.
Yeah, lots of things indeed.
Yeah, so lifestyle changes, genetics, there's a lot that goes into blood pressure in the first place. But what about ages? Are there certain age groups that should be particularly aware of their blood pressure?
Well, it's interesting. We've seen a big creep up in recent years and higher blood pressures amongst adolescents. And so blood pressure is a funny thing. It doesn't have a threshold, even though we like to think of that. You can be fine and all of a sudden you get to that number, 130/80. That's what's considered high blood pressure in America. The first number is the systolic blood pressure. That's the amount of force your heart pumps blood against the blood vessels. Diastolic, the second number, is the number that is the average pressure in the arterial system when there's no pumping occurring. So 130/80 is the number to know and be aware of. But we're starting to see that start to creep up in younger ages. And the thing about blood pressure is it's accumulated insults to your blood, your blood vessels over time that cause a problem. So you could be 115 at age 20, age 15, right? And then all of a sudden you're 125 and then 130 and 135 by the time you're 40 years old. It's that slow creep we're trying to really avoid. But we do know older individuals are the highest risk. Almost 80, plus percent of people who are over the age of 65 are going to have hypertension.
Okay, let's talk about lower or middle income communities. Of course, we know that there are disparities within healthcare in a wide range of areas. This seems to be one of them. What are some of the biggest barriers to that? And can you speak to experience as to what you've found in your studies?
Yeah, absolutely. So we do a lot of work. I'm an emergency physician by training. I've worked at Detroit Receiving Hospital for more than 20 years. I also oversee a large mobile health infrastructure, which was developed during the pandemic as a way to kind of fill in some of the gaps in reaching populations and delivering health care, right? When in a time when doctors' offices were closed and people couldn't get the care they needed. One thing we know in lower income communities is that it's harder to get things like transportation to go to doctor's appointments. You might not have co-pays to pay for your medications if you need them. And even though I didn't emphasize it earlier, taking medication if you're on medication for blood pressure is really, really important. There's issues with adherence. But again, that's magnified in lower income communities. There's also things like just the stress of general daily living, and that's compounded with environmental factors like pollution. We know that PM 2.5 are the small particles that exist in the air, especially in urban communities, that can also cause some inflammation in the blood vessels and lead to elevated blood pressure. So it's really a confluence of factors. And then you mix in some of the other stuff, what are called social determinants. That's become a hot topic as of late. Again, that has to do with the stress and socioeconomics that may lead just people having harder lives and leading a harder life, not getting enough sleep, waking up early for a job, having limited transportation. All of those things can make your blood pressure rise.
Yeah, it's so interesting because not only are there factors within your own blood pressure, but there are factors just within society in general that go to impact that as well.
Yeah, really thinking about how that's impacted by your community. What are some of the ways that the industry is taking steps towards making sure that everybody has access to that care and education?
Well, like I said, we're fortunate in the state of Michigan. We've done a lot of stuff between mobile health outreach and neighborhood wellness centers where the state has supported, Michigan Department of Health and Human Services has supported interventions to bring care to people. And I think that's an important thing to consider. Going forward, high blood pressure is so ubiquitous. It's so common. It's estimated that, in the Black population, which is that particular risk, almost 55–60% of the population is going to have high blood pressure. We have to make care more accessible. And it's got to be not, I need to take 3 hours out of my day and go to my doctor's office and miss out on a half a day of pay, if I'm getting hourly pay or whatever it might be. It's got to be, you can go to your pharmacist, you can get your blood pressure measured in a common location, and you can get access to prescriptions very easily. Things like having pharmacists work under collaborative agreements where they can prescribe and make that medication available. Those types of things are really, really important.
If somebody needs to get their blood pressure checked, or let's say they haven't been to the doctor in a while, where can people start? It can be sometimes hard to find that primary care provider or, somebody to help them out in that way. So what would you recommend people do?
Well, again, you can go to your pharmacy. A lot of pharmacies now have kiosks where you can get your blood pressure measured. They even have rooms where, you can see a pharmacist who can measure blood pressure. There's a lot of community events that occur, health screenings, health fairs, where people can go get attention like this. There are mobile outreach programs, like I said, on the east side and the west side of the state. But, short of all of that, you can go buy a blood pressure cuff. And it's pretty easy to do in a supermarket, in, a pharmacy. They're $20, $25. I know that's, not everybody can afford that, but you can start to monitor your own blood pressure. And that's one of the most important things we're understanding nowadays. Self-monitoring and self-management of this is critical because, you go to your doctor's office and you get your blood pressure measured. That's a single point in time. That's one 5-minute period of measuring your blood pressure. But we like to know what's going on, in the morning, in the evening, throughout the day with certain people when we're worried about their blood pressure. So, go get a cuff and start to measure it yourself. It's pretty easy to learn, and there's a lot of good resources on the web that will instruct you how to do it.
All right, and we'll have to leave that great conversation there. Of course, World Hypertension Day is this Saturday, a day to kind of mark and remember to keep that blood pressure in check. Doctor, we appreciate your time this morning.
Thank you both very much.